Hey guys, welcome back to Clever Scrubs. Today we're going to be talking about carotid endarterectomy and everything you need to know to help you be prepared. Stay tuned. Alright guys, so a carotid endarterectomy is a removal of plaque from a carotid artery through an incision in your neck. Now there are two carotid arteries and two vertebral arteries in the back, and they form the circle of Willis, which provides circulations to your brain, and having this surgery helps reduce the risk of a stroke. So how do we prepare for this surgery? There might be a couple of tests to help determine the extent of the carotid disease, which include carotid ultrasound, which uses ultrasound wave to get a picture of the carotid, a carotid angiography, which is a special x-ray which requires a tube to be inserted in your groin to get a better picture of your carotid. Also, they have an MRA and a CTA. The CTA involves the CT scan machine, also with the injection of a dye to get a good look into your vessels. Now, things you want to tell your doctor before having the surgery is if you're allergic or sensitive to any medications, iodine, tape, latex. Also bring them a list of all your medications, including prescribed, over-the-counter, herbal medications you might be taking, and supplements. Another important point is to let them know if you have a history of any bleeding disorders, or if you are taking any anticoagulant like blood thinning medications, because you might have to stop this medication before your surgery in order to prevent any excessive bleeding. All right, so let's talk about now the day before the surgery. You should not eat, you cannot eat or drink after midnight, and you can ask your doctor if you can take any prescribed medications during this time, and plan to stay in the hospital for about 2 to 3 days. Now, the day of your surgery, you will be admitted to pre-op. You also will need to sign the consent for the surgery. If you are not already done so, then a nurse will insert a peripheral line, draw a set of labs, leave your belongings with your family members, or you can have the nurse call security to hold on to your belongings until you're out of the hospital. Also, a Foley catheter will be inserted to drain your bladder. Anesthesiologist will come greet you, and they may give you some sedative in your IV and place an arterial line in your wrist to monitor your blood pressure continuously. From pre-op, you will go into the operating room where the surgeon will perform the endarterectomy, making a skin incision over the carotid artery. The surgeon places clamps above and below the blockage, which temporarily stops the blood flow from the carotid. But don't worry, because remember, the brain gets blood flow through the other carotid and the other vertebral arteries in the circle of Willis. Now, if the other carotid has advanced disease as well, the surgeon might place a shunt until he's able to loosen up the plaque around the arterial wall and remove it. Then they close the arterial incision using a patch or sutures. They remove the clamps, suture the skin, leaving a small tube to drain any excess blood. In total, the surgery takes about 1 to 2 hours. Now, after the surgery, you'll be going to recovery area where you wake up from anesthesia for about 1 to 2 hours. From then, they'll move you into a cardiovascular ICU or an ICU, where their ICU nurse will monitor your heart rate and blood pressure frequently using the arterial line in your wrist. They want to keep your blood pressure, your systolic blood pressure, between 100 to 150. It is common during this time that you come out a little bit more hypertensive due to the manipulation of your carotid and your baroreceptors in the carotid. During this time, they could give you continuous IV infusion of medication to keep your blood pressure low. Now, the day after your surgery, the drain from your neck will come out. If it's not draining too much blood, the arterial line in your wrist will come out also. Will be discontinued if your blood pressure is controlled. Your diet will be advanced, and you'll be allowed to be out of bed. Now, in most cases, the patient is already discharged on that day, the day after the surgery, if there are no complications. Complications for this surgery, it's very low risk, about 1 to 3%, and they include a transient ischemic attack or a stroke, heart attack, swallowing problems, bleeding, or infections in the wound. I hope you find this information helpful, and always remember to follow your healthcare provider's instructions. And I'll see you guys next time. Thank you.